Thank you for joining us, whether you're watching us on TV or maybe online. I'm Farah Nasser. Prime Minister Justin Trudeau is set to provide his daily COVID-19 address from outside Rideau Cottage in about 15 minutes. So while we wait, let's take a look at your numbers across the country. We have reached several significant milestones this morning. Take a look. We now know that more than 1 million Canadians have been tested for COVID-19. More than 65,000 of those tests have come back positive, and close to 4,500 Canadians have died due to complications from COVID-19. We want to take a look at the number of cases across the country for you as well today. Take a look at British Columbia. It's reporting 33 new cases, 19 new cases in Saskatchewan. Manitoba sees another day with no new cases. Ontario is reporting 477 new cases. Those numbers came out just moments ago. And single-digit increases or no new cases at all in the East Coast, as you can see. And you might have heard by now that the Canadian economy has taken a massive hit during this pandemic. And now we're seeing just how damaging April was. Almost 2 million jobs were lost as the closure of non-essential services forced businesses to shutter. This record-breaking loss comes on top of the more than 1 million jobs lost in March. Economists, on average, expect a loss of 4 million jobs and an unemployment rate of 18%. And unemployment numbers, they are smashing records on both sides of the border. More than 20 million jobs were lost in the United States last month. That brings the unemployment rate to 14.7%. That is the worst one-month drop in U.S. history. The losses reflect what has become a severe recession caused by businesses suddenly shutting down in nearly every industry. And in addition to the millions of jobless Americans, more than 5 million others there have had their hours reduced. We have comprehensive coverage on the COVID-19 situation and the economic fallout from across the country. Our chief political correspondent, David Aiken, joins us with more on these grim job numbers that are out this morning and specifically the demographic that's being hardest hit. He'll also have a preview coming up on what to expect from the Prime Minister's address. We also have Travis Stanraj joining us from Toronto as that province slowly begins to reopen. And Carlisle Fissette joins us from Saskatchewan, from the legislature there, with more on how that province is getting back to business. We're going to start with you, David. David, 2 million jobs lost in April, again, 1 million in March. So that brings the total jobs lost since the pandemic began to 3 million. But we're seeing a specific demographic that's being hit very hard. Who is that?
Well, this is what some are calling a she-cession, not a recession we're in, but a she-cession. And the idea there is that the job losses are disproportionately affecting women rather than men. And sure enough, in the numbers this morning, we are seeing a bit of a gender gap, or at least a growing gender gap, that sort of puts that on there. Young women in particular, these are women aged 15 to 24. Job losses last month for those women, 37%. 37% job losses for young women aged 15 to 24. By comparison, if you're for men aged 24 to 45, the job losses were just 10%. So again, young women, 37%, men, 15%. Overall in the economy right now, we've got an unemployment rate for women of 13.4% and an unemployment rate for men about a point lower, 12.6 or so. But here's the other thing, Farah, and all these numbers, and there's, I mean, believe me, economists, social researchers are having a field day with these numbers to see how this is all breaking down. But one of the numbers I think that's important to zero in on is 1 million people left the workforce. So that means that our participation rate has drastically lowered. People just saying, forget it, I'm not looking for work, I don't have a job, I might go back to school, or I might be living in a household where someone else is going to have to be the wage earner. And among those million who just left the workforce, a whole lot more women than men as well. So there is a gender gap. We're also seeing, as I mentioned, younger people were more likely to lose their work. Immigrants, people who have just arrived, also more likely to lose their work. And again, there's also a breakdown on lower waged workers, people who are earning 14, 15, 16 bucks an hour, also likely to have lost their job. And again, you think about the jobs that were hit hardest in this, or the industries, mostly the service industry, obviously restaurants, accommodation services. The healthcare industry has also been hit hard because we're not going to dentist's office, physiotherapy, optometrists, and no elective surgery. So the healthcare industry, believe it or not, has also been hit hard with job losses. So there's a big story there. But of course, one of the headlines you're going to hear all day is, it could have been worse. And it could have been a lot worse, because over the last month, we've been looking at these numbers and we're seeing 7 million Canadians have applied for the Canada Emergency Response Benefit, which means, by definition, you can't get the CERB if you have income of $1,000 or more a month. So a lot of people thought, oh my gosh, these numbers today were going to be worse. They are bad, but they're not as bad as many thought they could be. And bizarrely, that's why we're seeing stock markets in some, particularly in the United States, are doing all right, because a lot of people went, phew, could have been worse. It may still get worse. That's the big question. But it wasn't as bad as people thought for last month. We're
not out of this just yet. The Prime Minister, of course, quick to tweet as soon as those job numbers came out, saying we're here to support you. What else do we expect he's going to say in his address today related to this?
Well, I think that's the thing. So I mentioned the CERB, the Canada Emergency Response Benefit. So I think what the PM is going to focus on today is reminding Canadians, particularly those who are out of work, all the things that the federal government has done to support workers. So you're going to hear about the Canada Emergency Wage Subsidy, and that really just started to kick in. Employers just started to get that in the first week in May. And so next month's numbers, people might be back on their payroll. And so the unemployment rate actually may drop a bit, because the CEWS, as it's called, has kicked in. So you're going to hear from the Prime Minister on the emergency wage subsidy. You're going to hear about loans to small businesses called the CEBA, the Canada Emergency Business Account. And of course, you'll hear about the CERB as well as the CISB, as we're calling it, the Canada Emergency Student Benefit, CESB. CISB, that's how we're pronouncing it, which also kicks in now. So that, again, when they do this, when StatsCan does the survey next month of those unemployed, some may say, well, actually, I'm back on the payroll and I'm still employed, although, maybe at a reduced wage. One last data point for our, I know we want to move on. 1 in 7 have lost their jobs compared to pre-pandemic. But 1 in 4 have had either all or a whole bunch of their hours reduced. This is pretty widespread.
I just want to zero in on one more thing. I mean, I know we're talking about women, right? We're talking about women in the service sector. You talked about restaurants, salons, spas, all kinds of things. And my mind goes to even single moms. I mean, there's no school, there's no childcare for even these moms if they wanted to get back to work. But are there going to be policy changes when we see a lot of men lose their jobs in terms of where the demographics go? We talk about infrastructure spending. Will the Prime Minister or the government be addressing ways to restart the economy, but as it specifically applies to women?
Stay tuned, because I hope that if Global gets a question, you're going to hear something right along those lines. And that's a really good point. For example, one of the keys to getting women into the workforce, pandemic or not, is sufficient childcare spaces, and particularly now without schools open. Childcares are often run by women, and childcares are dependent on the fees that parents sending their kids to childcare depend on. Well, childcare centers are not getting those fees. So many childcare centers may be some of the businesses that are disappearing in this pandemic, making it even more difficult now for women to find childcare spaces for their kids so they can go back to work. So you are definitely going to see, I think, pressure to see a different gender response from the government when it designs policies to put people back to work. In 08-09, when we had the fiscal crisis, it was mostly the construction sector and finance that got hit. Industries where there's a lot of guys. What do you do there? Infrastructure programs. Just build a lot of stuff. That's not going to work this time. It's the service sector, and it's service sector that is largely where females are employed. They're going to need different kind of supports, women, in order to be able to resume their place in the workforce.
Okay, and you talk about 08-09. It took years for us to get that growth, and then we're seeing it undone in just a few months. Okay, thanks for that, David. The Quebec government has pushed back the date for reopening elementary schools, daycares, and businesses in the Montreal area, as we're talking about childcare. They now won't be allowed to reopen until May 25th. Quebec Premier François Legault says the infection rate in Montreal, it is still too high. And he says the province is also struggling with a lack of staff in the healthcare system. Montreal has more confirmed cases of the virus than any other city in Canada. Meantime, it has been a busy week for Ontario's government as it continues to announce measures to slowly reopen that province. Travis Danaraj joins us now from Toronto. We'll get to what's reopening in a bit, but I just want to ask you about a controversy that the Premier finds himself now in. The idea of going to a cabin or a cottage across Canada has been confusing for a lot of Canadians, but the Premier has said one thing and did something else. Tell us more, Travis.
Yeah, that's right. So this happened during the Easter long weekend back in April. The Premier, I asked him a couple of days before that, on the 8th of April, about his advice for folks that want to go to the cottage, want to go to the cabin. And he said unequivocally, do not go to the cottage. I have a cottage. I'm not going to go to my cottage. Well, turns out that very weekend, he went to his cottage. The Premier's office confirming that to us, but certainly it presents a bit of an optics problem for the Premier. He's going to have to explain this at his news conference today. And also, it mixes up the messaging for folks. Should they go to the cottage? Should they not go to the cottage? And the Premier's office really has kind of been all over the map when it comes to this. Earlier this week, they said, they can't prevent taxpayers from going to their second residence. But then the Premier had a call with some of the mayors of these smaller communities in cottage country, and they said, we can't deal with this, an influx of folks from the city right now, so please everyone stay home. Then the Premier's message changed, and he asked folks once again. But this is one of those unforced errors. This is a distraction that the Premier's office does not need right now, and certainly there will be a lot of questions on this today.
Absolutely. Okay, Travis, what are the steps that Ontario is taking right now to reopen the economy? And also, is it meeting its testing? Because that's such a key part to reopening.
Yeah, right. Testing has been an issue, and the Premier pretty forceful about some comments that he made earlier this week about regional health directors. Here in Ontario, we've got 34 local chief medical officers of health and then a provincial medical officer of health. And the Premier said earlier this week that some of those folks were not pulling their weight when it comes to testing. He walked those comments back a bit, but it came on a day when we saw about 10,000 tests done in a 24-hour period. The mark right now, the goal that the province has set, is 16,000 tests. Now, we did meet that mark in the past 24 hours, but certainly it's ebbed and flowed, and several days this week we have not met that mark. So that's the issue when it comes to testing, and the Premier said, quote, everyone needs to pull up their socks and really deal with this issue, because testing is key when it comes to containing the virus and having a better picture, he says, of the enemy that we're all facing. When it comes to reopening the economy, it is very much like turning on a dimmer switch, Premier Ford said, not flicking on a switch and everything's completely on. And we are seeing signs of that. Today in Ontario, garden centres open for in-store purchases. We're seeing tomorrow hardware stores open. And then on Monday, some very good news for retail stores. Retail locations that have go onto a street will be able to open for curbside pickup and also delivery, Farah.
Okay, Travis Danaraj in Toronto. Thank you, Travis. Now to another province that's beginning to reopen, Saskatchewan. Joining us now from the provincial legislature in Regina is Global's Carlisle Fizette. Where does Saskatchewan stand, Carlisle, in terms of reopening?
Well, Farah, the reopening process began in earnest today officially, although compared to other provinces, Saskatchewan's is actually a little bit more conservative, especially when you look at what a province like Manitoba is doing next door. For example, restaurants were able to open patios in Manitoba this week, but restaurants right now, there's no date even in Saskatchewan for them to resume. We're still only in phase 1 of 5, and that only included some medical services like chiropractors and optometrists. This week opening up, and even then with very strict screening guidelines, and PPE had to be used. So Saskatchewan is taking a very measured approach to this. Phase 2 is the only other phase with a date, and that's not until May 19th, when some retail and other medical services might be able to resume.
Okay, Carlisle, we're looking at a shot of Rideau Cottage, and the Prime Minister might come out, but I want to ask you this question because some people are wondering about this. The CFL season, now it's likely going to be cancelled. What does that mean for Rough Rider fans?
Oh, that would be a huge emotional loss for the green and white and their faithful, I can assure you, especially because this year Regina was supposed to host the Grey Cup. So if this season gets canceled, the 108th Grey Cup won't happen in Regina, and that's a huge, not only emotional loss for the community, but of course economically. This city was relying on that big time for a huge amount of people and influx of revenue that comes with the Grey Cup. Next year's Grey Cup's already been awarded to Hamilton, so if this season is lost, that basically is at least another year, 2-year wait for that major festival to come back to this city. And Rider fans were very much hoping that they would see their green and white at home in the Grey Cup. The last time they hosted in 2013 at the old Taylor Field, they won the Grey Cup. This would have been the first Grey Cup at the new Mosaic Stadium. It would have been a huge celebration, so a big loss there for the community and Rider fans for sure.
We were just looking at shots of Rough Riders faithful in packing a stadium, and it just, those shots we don't see anymore. People so close together and enjoying sporting events. Let's turn it over to politics in the province of Saskatchewan. There's a provincial election scheduled for October. Is that still going to go ahead?
Well, as of right now, the date is still set for October 26th, but that's sort of in flux because just this week, the province's chief electoral officer recommended an advisory council to come together to look at what's possible. According to Saskatchewan law right now, the latest date that the province could hold an election is April 27th, 2021, but legislative action would have to take place to make that a possibility. So there's a lot that still has to take place. Mail-in ballots are a possibility, but that would really only be possible for a spring election as well. And the Saskatchewan government themselves, the Sask Party, are itching for an election as well because they saw the results in the federal election when the entire province, every single riding, went Conservative. And this is a premier and a government that considers premiers like Jason Kenney in Alberta, Doug Ford in Ontario as close allies. So they saw those results and said, we got to get on this momentum quickly, and they teased the possibility for a while of a spring election, but obviously COVID-19 put the quash on that. But they only put the quash on that after the World Health Organization declared a global pandemic on March 11th. So the Saskatchewan Party wants an election. When they'll have it, that's still up in the air.
Interesting. There are concerns about cases in the province's north. We have only a few seconds left, but I want to hear a bit about that.
Yeah, it's really a tale of two different curves in Saskatchewan. You mentioned off the top of the broadcast 19 new cases in Saskatchewan. All of those are in the north. No new cases in Saskatoon yesterday or Regina or anywhere in the south. So that is a very complicated process because of the nature of the demographics in that region. A lot of households with many family members living close together. It's a complex situation that is really where the curve is steep in the north while it's very flat everywhere else, which is why this reopening plan across the rest of the province is going ahead. It's not going ahead anywhere in the north. That's on pause, but the rest of the province, because everything is so flat, is able to move forward.
Yeah, I mean, Saskatchewan's not the only province that has a tale of two cities or tale of two areas. Like we've seen that in Quebec as well. Of course, Montreal, very different from the rest of the province. So we're watching that. Thanks so much for speeding through that. I know we're waiting for the Prime Minister. That is Carlisle Fissette. He is in Regina. Here is Prime Minister Justin Trudeau outside Rideau Cottage. Let's listen in live.
Justin Trudeau speaking live at Rideau Cottage with today's daily update on COVID-19.
Today, we received the job report for April. These numbers tell us what we already knew, that right now, Canadians are hurting because of this pandemic. Everyone has their own story, but it all boils down to a very difficult time for a lot of people. Canadians aren't alone in this, as the world faces COVID-19. But if you're out of work, you don't need to hear that other people are out of work too. You need to know that there's a plan to get you through this and get you back on the job. And that's exactly what this government is focused on. Aujourd'hui, on a reçu le rapport sur l'emploi.
Today, we received the jobs report for April, and the numbers confirm what we've known for a while. Many of you are suffering because of this pandemic, and what is the most important thing for you is to know that there's a plan to help you go through this and to return to work as quickly as possible. This is what our government is concentrating on.
Unprecedented challenge, we've taken action. Maybe you're one of the more than 7 million people getting the CERB to help make ends meet. Or better yet, maybe thanks to the wage subsidy, your employer has been able to rehire you. That's what happened for people who work at Pursuit, a Banff tourism company. They're back on the job because of this program. We created the Canada Emergency Wage Subsidy to protect jobs wherever possible. Since it launched last week, employers have applied for subsidies for almost 2 million workers. And as provinces and territories start to gradually reopen over the coming months, and the CERB becomes less and less needed, this subsidy will play an even greater role. That's why I can announce today that we will be extending the Canada Emergency Wage Subsidy beyond June to help kickstart our economic reopening and boost jobs. We'll have more details next week, but to businesses hit by COVID-19, know this: the wage subsidy will continue to be there for you to help you keep your employees on the payroll. So fill out the application at canada.ca if you haven't already done so. And if you had to let people go, try to bring them back. It's those workers who will drive our economy's short and long-term recovery. On other support, the Canada Emergency Business Account has been accessed by well over 500,000 businesses to give them much-needed loans. Between the CEBA and the wage subsidy, we're helping employers across the country keep Canadians on the job. Now, even though we're reaching millions of Canadians, we need to reach even more. We're working around the clock to update and adjust so that help gets to as many workers, small businesses, families, and young people as possible. We also know that some sectors have been hit especially hard, so we're stepping up on that, too. Minister Baines will be leading a new Industry Strategy Council. Chaired by Monique Leroux, this council will take a deeper dive into how the pandemic is affecting specific sectors and how to best support them. We're leveraging expertise from the economic strategy tables we set up in the first mandate, as well as looking to new industry leaders. This will be a dedicated forum for industry and government to come together on tackling the effects of COVID-19. And it builds on what we've already done for workers in everything from energy to agriculture. On that note, Minister Guilbeault will have more details at noon about how our $500 million package for arts, culture, and amateur sport is now being rolled out to support workers in those sectors. This investment will help people access wage support and help organizations access funding. Our artists, creators, and young athletes inspire us and help us feel connected even when we're at home. They're there for us, and we're going to be there for them. No matter where you work, no matter who you are, these are tough times. But with the right plan, we will get through this, and we'll come back stronger than ever. Le Canada
Canada is facing an unprecedented challenge, so we have taken unprecedented measures. Perhaps you're among the over 7 million people who are now receiving the Canada Emergency Response Benefit. Perhaps you have been hired once again due to the Canada Emergency Wage Subsidy. This wage subsidy was created to protect jobs. Since the launching of the program last week, employers have already made requests for almost 2 million workers. Today, I'm announcing that we will extend the Canada Emergency Wage Subsidy past June to boost job creation and to stimulate the economy. We will have more details next week. Businesses hard hit by COVID-19 need to know this. The wage subsidy will be there for you and for your workers. I'd invite you to make an application on the canada.ca website if you've not yet done so. If you've had to lay people off, please try to hire back your workers. These workers will help us to relaunch the economy over the short and the longer term. Canadians want to work, so we will help them to get back to work. Because of this subsidy, other measures such as the Canada Emergency Business Account is also used to help employers to keep their employees. Today, We also have news for the cultural sector. Minister Guilbeault will provide more details on this later today, but we are trying to support artists, creators, musicians, young athletes, and their trainers. To better understand the impact of the pandemic on different industries, we are creating an economic strategy table led by Minister Baines. Chaired by Monique Leroux, this Industry Strategy Council will study the effects of the pandemic in specific sectors, and especially what can be done to support workers. We will benefit from the economic strategy tables that were created during our first mandate, and we are calling upon new industry leaders to help us. We're going through hard times right now, but with a good plan in place, we will recover stronger than ever.
Tougher times for our country, but as our elders remind us, Canada has faced challenges before, and we've always overcome them. Today, we mark the 75th anniversary of Victory in Europe Day and the end of the Second World War on the continent. After 6 years of war, it must have felt like that day would never come, but it did. And it came because of the courage of all who served and because of the sacrifice of all who gave their lives. It has been 75 years since our grandparents and great-grandparents stood up to do their part. 75 years since they stood united and strong to ensure that we would live in peace and freedom. Today, as our generation faces our own battle, let us be inspired by them and their valor as we protect them and all Canadians. This is our challenge, and I know we will rise to meet it. Merci.
Thank you, Prime Minister. We'll now go to the phone lines for questions. One question, one follow-up. Operator.
Thank you. Merci. The first question is from Jamie Tashagumscum from APTN. Line open.
Thank you, Mr. Prime Minister. As we all know, Indigenous communities in the North are vulnerable due to social conditions like lack of housing and lack of medical facilities. And it's been said that Indigenous communities are 2 weeks behind the curve. Now, with provinces relaxing restrictions, some of these communities might see that as a threat. Do you agree with that opinion? And secondly, what would your advice be to those communities?
From the very beginning of this pandemic, we have seen that and known that Indigenous communities, particularly northern and remote ones, are particularly vulnerable to the spread of COVID-19, given existing challenges around medical facilities, things like overcrowding and other socioeconomic realities. That's why from the beginning, we have made specific investments to support Indigenous communities as the country grapples with this pandemic. Right across the country, as certain regions are reopening, there is a recognition that other regions are going to need continued adjustments and continued protections, and we will ensure that we continue to work all together on protecting Indigenous communities who are indeed more vulnerable, even as other parts of the economy are looking at opening up.
Follow-up, Jamie?
Yeah, okay, so they've been doing pretty well so far, but like I said, they're 2 weeks behind the curve. So with provinces opening up, what would you suggest that they do?
I think we need to make sure we're keeping extremely vigilant and preventing outside cases from entering those communities. We've seen, for example, Nunavut be very successful, not just remaining 2 weeks behind the curve, but months behind the curve as they continue to have no cases because of very strong travel restrictions that were brought in immediately and have served to keep the vulnerable and remote communities in our far north completely COVID-free. But right across the country, various communities will take appropriate measures, and we will be there as a government and other orders of government as well to support them in doing the things that need to be done to keep elders and all in those communities safe.
Thank you. Next question, operator.
Thank you. Merci. Prochaine question, Michel Lamarche, TVA Nouvelle. À vous.
Hello, Mr. Trudeau. I'd like to know, because you're going to extend this wage subsidy, are you going to do the same thing with the CERB? The CERB lasts longer than the wage subsidy. We recognize that over the following weeks and months to come, and with the economy restarting again, less people will need the CERB because they will go back to work. It is more likely that more people will choose to go the way of the wage subsidy. That is why today we are announcing that the wage subsidy will be extended. We are continuing to adjust as the situation evolves. Since the beginning, we've been there to make changes and to improve our approach, to be able to help as many people as possible, especially given the current situation.
From the beginning, we recognized that we needed to constantly adjust and improve the delivery of these unprecedented mechanisms to support Canadians who are suffering through this particular crisis. That's why we recognize that there are many different things we need to do as the economy starts to reopen. The Canada Emergency Response Benefit had always been planned to last longer, or had a timeline that was already longer than the wage subsidy. But we recognize that as the economy starts to reopen, people will be getting back to work, leaving the emergency response benefit, and perhaps going on to the wage subsidy as employers bring people back on and get them back to work as our economy picks up over the coming weeks and months. That's why we will constantly be adjusting to make sure that Canadians are getting the support they need as we look to carefully and gradually restarting our economy.
Michel?
Yes, I would like to know more about this wage subsidy. The extension should last how long? And if we look at reopening the economy, there are some concerns. Do you think that we should slow down? Do you think that we're lifting the measures too quickly? Since the beginning, we've spoken of the importance of opening up very, very gradually and to be extremely vigilant, to closely monitor the transmission of COVID-19. This is why we are making huge investments in tests. This is also why we have to make sure that the necessary mechanisms are in place throughout the country as we start up the economy again. The wage subsidy will be extended past June. We will have more details on this next week. I already want to tell businesses who are looking at how they can get closer to reopening, they can be sure that the wage subsidy will be in place for a while still. And so they should begin hiring back their staffs in order to create this link between the worker and their employer in order to relaunch the economy very quickly.
Thank you. Merci. Next question. Mike Blanchfield, the Canadian Press. Line open.
Hello, Prime Minister. Two successive job reports are showing that women in service roles have been disproportionately affected by the pandemic. In light of that, what specific measures do you think are needed to strengthen Canada's economic recovery?
I think this is one of the first recessions we've ever seen that has so hard hit vulnerable workers in the service sector, particularly women and new Canadians and young people. And that was evident in the March numbers and continues to be the case in the April numbers. What we're seeing, even beyond these reports and these numbers, is the reality on the ground that people who are already vulnerable in the workforce, people who are already disadvantaged or facing extra barriers, are always the first to get hit when we have a difficult situation like this. That's why, as a society, not only do we need to do what we are doing in the short term to give extra supports to vulnerable people, but we need to make sure that as we move forward to rebuilding and creating a more prosperous Canada in the coming months and years, we think very, very carefully about how important the work is that is being done by women and vulnerable Canadians, and how we need to make sure we're better supporting them, not just for potential future crises, but for business as usual as our country comes back to normal.
This crisis was very difficult for women and for vulnerable people, for new Canadians. Their jobs were among the first to disappear. This is why we implemented specific measures to help the most vulnerable. Beyond this crisis, we have to think about how, as we're rebuilding the economy, we can make sure that these vulnerable people will be rendered less vulnerable in a new economy. How can we make sure that in the years to come, we will take care of all workers in the country so that we will have a more fair and equitable country?
Talking about, and that these vulnerable people are, as you say, the first to get hit. How will you ensure that government stimulus money helps those people first and does not go instead to the bottom lines of big corporations?
Well, we are not yet talking about stimulus. We are still very much in the support and emergency phase right now. And that's why from the beginning, the measures we put forward have been entirely focused on Canadians. With the Canada Emergency Response Benefit, that's over 7 million people across this country who have benefited from that. With the wage subsidy that goes to workers. Employers don't keep a penny of that. They pass it through to their workers so that workers have that continued link with their job and get a paycheck that will ensure that as the economy reopens, they will be able to come back to work quickly and smoothly. Our focus every step of the way, even on supporting small businesses, has been ensuring that people are able to keep jobs going for Canadians from coast to coast to coast. We will, over the coming days, start looking at specific sectoral supports for various industries that have been hit particularly hard by COVID-19. But even then, our focus will be on the workers, on the supply chains that involve many, many small businesses across this country for many of these industries, and not on the corporate well-being of an industry or of a sector, but indeed staying focused on helping Canadians, because it is Canadians who are at the heart of our economic success, at the heart of our success as a country, and as a government, we will always stay focused on them.
Thank you. We'll take one more question on the phone. Operator.
Thank you. Merci. Prochaine question, Marie Vastel, Le Devoir, à vous.
Hello, Mr. Trudeau. I would like to come back to the CERB. We see that daycares and elementary schools are starting to reopen, and there are a lot of questions being asked. If we talk about people who work in daycares and they don't feel safe to go back to work right now, can they refuse to go back to work and receive the CERB? In Quebec, the government thinks that this is a safe work environment. So I'd like to know, can a personal perception of risk that one's workplace is not safe, is that enough to refuse going back to work and to receive the CERB? In no case during a crisis or during normal times, no Canadian should have to go work if they're concerned for their health and safety. We have very stringent standards in place to ensure that in normal times, workers are able to work safely. During this pandemic, these concerns have been amplified. And this is why, in the principles that we set out with the provinces and territories, there is this element of safety at work that is essential for reopening up the economy. We expect that work conditions, even in essential workplaces, will be safe. People should feel safe to go back to work.
One of the things that is fundamental in Canada is that no one, whether in crisis times or in regular times, should be working in a job in conditions that are unsafe or put them at risk. That is a fundamental principle of Canada that we will always ensure to uphold. In this particular situation, there are heightened concerns about health for a large number of people, for everyone, but particularly and even in essential work sectors. We need to make sure that we are putting in place all the necessary measures so that people can feel confident about their own safety, about having minimized the risks as they get back to work. That's why we put that as one of the fundamental principles that needs to be in place before any sector talks about reopening the economy. That was part of the principles agreed to by the provinces and the federal government on relaunching our economy.
Minister Murray?
Thank you. If we speak about the conditions that have to be respected to have a safe workplace, I understand that, but who determines if the workplace is safe or not? I'm asking my question once again. Can a person themselves decide that in their personal perception that they don't feel safe to go to work in a daycare, for example? Or will the government decide if a request for CERB is legitimate or not? This will be decided according to a case-by-case basis. The government will have something to say with regards to the needs for certain sectors and certain industries. We also know that in some cases, if we speak about a person who is taking care of a senior at home, and that these people are very vulnerable, or if they have a pre-existing medical condition, the levels of protection that they require can vary. I think that we'll all have to work together in a very reasonable and detailed fashion to make sure that the measures are in place to protect people. Mr. Trudeau, Radio Canada, eventually we will have an opening up of the Canadian economy. We will have some sectors of the economy that will be given that will be going first. Are we looking at transforming the Canadian economy? I think that the priority is to restart economic activity for Canadians and for workers in many sectors and throughout the economy. At the same time, we will have to think about this opening up, how we can do it in a safe way, given the continued reality of COVID-19. There are other things that have to be thought about. We've all learned that there are challenges and advantages to working from home. And there will be a need to invest more in digital technologies and to shift to more digital technologies. Certainly, we will continue our fight against climate change, and this will allow us to do more, I think, in many sectors. I think that it's important to think about what Canada could look like in 1 year, 2 years, 10 years, and to aim for that. But at the same time, what we want is to be able to start creating prosperity for all Canadians right now. We've seen in the figures this morning, youth are very hard hit by job losses. Are you going to extend the emergency assistance for students? We've already planned that the emergency assistance for students would be there up until August. Students, typically when they are finished their term at university, take a summer job to help them pay for their tuition and their needs, and to pay for their expenses over the school year. The assistance for students will be there to replace these thousands of jobs that will not exist for youth this summer. We know that they want to work, and they're going to try to fill, that they will fill the jobs created by the government, and there are new programs to help in some specific sectors that are hard hit by COVID-19. We do have measures in place to help the youth, and these will last up until August.
Just I'd like to ask you about the jobs numbers again. You were talking about just how some groups are getting hit disproportionately hard, thinking young people, thinking women. What specifically can the government do as the recovery begins to make sure that these groups aren't permanently set back?
I think the idea of permanent challenges is particularly poignant for young people, where we know that a summer without work experience, a summer where they are struggling to pay their groceries or their rent, is a significant setback in their march towards economic independence and successful outcomes after their schooling. That's why we put in place the Canada Emergency Student Benefit to help them this summer make sure that there aren't long-term impacts. On women particularly that we've seen have been extremely impacted by this economic challenge as well as a health challenge. We have moved forward on supports for them, particularly more emergency supports for women who are facing challenges of domestic violence. But at the same time, we know we have to do more. The importance of childcare has been yet again emphasized, that as we move towards an economic restarting, there needs to be more and secure childcare spaces for people to get back into the workforce. These are the kinds of things that we're going to have to think about, both in the immediate, but also for the longer term, to make sure that equality in this country is more than just a goal, but is a concrete reality.
Je pense qu'il y a bien des choses qui nous préoccupent par rapport.
I think that we have many concerns with regards to the years to come. If we look at groups such as women, youth, they might suffer negative consequences for years to come following this pandemic. If we look at the youth, this is why we've implemented the student benefit, and this will support them during the summer and up until the end of August. This will allow students to continue their studies in the fall without having too many impacts following the crisis. Also, we're creating work opportunities so that many of them will have some necessary work experience, and this will be helpful in the years to come. Now, with regards to women, we know that there's a lot more that needs to be done to have a more fair society. We know that more assistance for centers for victims of domestic violence and for women's shelters are very important. We know that access to early childhood education centers and daycares will be very important also for boosting the economy and for Canadian families, and particularly women. This is why we're looking at what we can do.
Toronto, the TTC is going to be making some historic cuts to its service because of the pandemic. Transit groups have been calling on the federal government to provide emergency funding, keep buses, trains rolling, get emergency or essential workers to their jobs. Is that something that the government could look at?
This government has made historic investments in transit over the past years. We recognize that public transit is an essential part of growing the economy, of helping our cities, and mostly helping people be able to get to work from home in a reliable way. That's why we believe so deeply in transit. Operation of transit is more of a municipal and provincial responsibility, and we hope to see the provinces stepping up on supporting this essential element of the economic relaunch. People are going to need to be able to get to and from work as we want to get the economy going again. But the federal government is always looking to be a partner in helping out in terms of economic relaunch wherever we can.
Prime Minister Rachel Haynes from CTV National News. Last week you were saying that help is coming for seniors. They have been asking for the last few weeks where the help for them is. You're talking about the Canada Emergency Response Benefit, which gives $2,000 to the people who you say need it most. But seniors are still vulnerable and they still need to pay their rent and their groceries, and they're saying that the government programs that they receive still don't add up to $2,000. So why do some people deserve $2,000 from the government and other people don't?
First of all, we have worked very, very hard to help all Canadians with replacement of income that has been lost during this. We knew that workers who were expecting to get a paycheck to be able to pay for their groceries, to be able to pay for their rent, and suddenly because of COVID-19 lost their job, and there were millions of them, as we saw in the recent job numbers today. Needed to get that income replacement. And we did that with the Canada Emergency Response Benefit. Seniors, many of whom are on fixed incomes, did not see that disappearance of their income at the same time, although some did, and many qualify for the CERB, even as seniors, and therefore are getting the support. At the same time, however, we recognize that there are additional costs and additional vulnerabilities that seniors have been facing, and that's why we have made investments, whether it's through increasing the GST supplement that hits many, many vulnerable seniors, whether it's through new programs that are supporting seniors in vulnerable situations. And like I said, we'll have more to say very soon on how we continue to support the seniors who built us this extraordinary country and to whom we owe so much thanks.
Since the beginning, our priority has been to replace the income of those who lost their jobs due to COVID-19. These were people who were expecting to receive a paycheck to pay for the groceries, to pay the rent. We went forward very quickly with benefits to help them. Over 7 million Canadians are receiving the Canada Emergency Response Benefit. This has been urgent and essential. There are other groups, such as seniors, where many are also qualified for the CERB because they had a work revenue. And even if they have not lost their fixed revenue or access to their pension, they see a greater amount of challenges or increased costs due to COVID-19. We've taken measures that had an impact. We increased the GST return. There are specific programs to support seniors, and we are there for them. As I was saying, we will continue to be there for them. We have announcements in the days to come as to how we're going to help our most vulnerable seniors who are going through a very difficult time.
To a colleague's question, you said that people don't have to go back to work if they don't feel safe there. Yesterday, workers outside of the Cargill meat plant, which is the largest outbreak in Canada, are saying that they don't feel safe going to work, even though their employers are saying that they've put measures in place. Should these workers be staying home, and what do you say to them if they're not feeling safe?
I'm not going to weigh in on specific cases in provincial jurisdiction, but I will say that it is a well-established principle in Canada and a hallmark of our values as a country that no one should be asked to work in unsafe conditions. That applies during a pandemic as well. We have put in many measures across various industries to minimize the risk, particularly around essential work. But we're going to have to be very careful to ensure that we're doing what we need to do right across the country, businesses, orders of governments, and all Canadians, to ensure the safety of the people who are working to provide for the rest of us.
Good morning, Prime Minister. Brian Mullen, Global News. Taiwan has donated 500,000 surgical masks needed by Canadian healthcare workers on the front lines of the pandemic. Your foreign minister wouldn't thank the country by name. Will you?
I'm happy to thank Taiwan for its generous donation. It is important at this point that Canadians and all people around the world pull together to be there for each other, because this is a global challenge that is going to face a global response. We need to do this together, and we will.
Marika Welsh with the Globe and Mail. The former Prime Minister of Australia, Malcolm Turnbull, says China is a bully and that the way for Canada to deal with China is to stand up for it instead of backing down. Is your government standing up to China, or is it backing away from China?
My responsibility as Prime Minister is to make sure that we're providing for Canadians and keeping Canadians safe. That's the job people expect me to do, and that is exactly what I'm doing. We're going to ensure that Canadians have the equipment, the supplies, the support they need to make it through this pandemic. And of course, at the same time, we will be asking difficult questions about how we're making it through this pandemic, how this came to happen, how we can learn from this. There'll be plenty of time for questions in the months to come. My focus, rightly, is on doing everything I can to help Canadians through this.
So are you standing up for China?
Merci beaucoup tout le monde.
Thank you, everyone.
That is Prime Minister Justin Trudeau speaking to reporters. The big headline out of this, the wage subsidy is going to be extended beyond June, not the CERB. Beyond June, the wage subsidy. Let's bring in David Aiken. David, we heard the Prime Minister he was asked about that, but he was also asked about what specifically he's going to do for women, for young people who are really seeing the unemployment rates higher than other demographics. Did he give us any indication?
No, not on exactly what he was going to do for some of those other demographics, women, etc., other than to essentially acknowledge that, yes, as he likes to say, some people are experiencing this downturn differently. So I guess we'll hear from those. But you're right. The big headline is that the Canada Emergency Wage Subsidy, the CEWS, will not end as it was planned to on June the 6th. And remember, this is a program that even though the money is going out to businesses basically this week, it's retroactive to March 15th. So the CEWS was to be in place for March, April, May, and June 6th, really only a 3-month period. And the cost for that was going to be $73 billion. It's just 3 months. So now it's going to be extended by a month. The Prime Minister will have more details on that next week. But almost certainly that is going to be a very significant cost if it's extended, given that it was $73 billion, an estimated $73 billion for just 3 months. Now, as far as the CERB goes, the Canada Emergency Response Benefit, the plan for that was a 4-month plan. So that's going into July right now. It will still exist. And when the CERB disappears, as it is going to disappear, then we go back to employment insurance. So people on the CERB, their EI eligibility is paused. And if you still don't have a job at the end of the CERB eligibility in June, or July rather, you can apply for EI. Of course, the government hopes that through the combination of a slightly opening economy and the CEWS, your employer will bring you back to work. So the CERB numbers are high right now because they were quick, right out of the gate when everybody got laid off. Emergency, essentially relief benefit. Now we have the CEWS in effect. Employers are getting back in. Economies reopen. The CERB numbers should drop because people will be returning to work, either through a subsidized wage or because the employer's back. So the CERB, if things go well, over time, there'll be less need for the CERB. The PM did hint at that, but it looks like they're acknowledging that there is going to be more need for the CEWS well past June, and who knows how long after that. And also, once again, the Prime Minister asked about sectoral support. Mm-hmm. And I'm thinking here of the oil and gas sector, the energy sector. Again, it's been almost a month now that Finance Minister Bill Morneau said support for the energy sector was, quote, hours away, if not days away. And again today, the Prime Minister is saying it's days away for sectoral support. So I guess TBD on that one. And certainly we're going to get asked. He's going to get asked about that tomorrow and into next week.
Right. He did, though, announce the creation of an industry strategy council. Tell us more about that.
Right. So this is going to be this is the idea of a council to take a look at how different industries are going to respond, reinflate, get everybody back to work, and that will help the government decide which resources go where. It will help the government decide on sectoral support. It's a little confusing why the government can't figure that right out now. There's no shortage of advice going right now to House of Commons committees from all sorts of sectors. Agriculture, airlines, tourism have been telling the government, here's what you need to do. But nonetheless, the government looks like it wants another council to consult with Canadians. Mm-hmm. The Industry Minister, Navdeep Bains, will head that. Again, I'm assuming the obviously criticism from the Conservatives and the NDP will be actions needed here, not more study.
Right. And also we heard about seniors, that other group. We keep hearing there's going to be help coming for seniors. He said in French, it's coming in a matter of days, in the coming days. So we'll see if that happens next week. Thanks so much for that, David Aiken in Ottawa. Here's a quick recap for you of what Prime Minister Justin Trudeau announced today. The federal government announcing today it's going to expand, again, the emergency wage subsidy program. We don't know how long, but we know beyond June. We're expecting to hear details about that in the coming days. We should know more next week. He was also asked repeatedly about the impact on Canada's most vulnerable groups, specifically women, young people. Trudeau says the effects of COVID-19 will be felt for years to come, and says for women there will have to be more secure childcare spaces in place in order to get people back to work. And as David Aiken pointed out, we're going to have more on our website, globalnews.ca. The CEWS, that is going to keep going and has a huge price tag associated with it. Again, more coverage, globalnews.ca. We now return you to your regularly scheduled programming. Have a great weekend.
Okay. Bonjour et merci de vous être joint à nous.
Good afternoon and good morning, and thank you for joining us today. I would like to first send out a word to Canada's children. I know this is a difficult time for you. You're stuck at home and you can't go out to see your friends. However, Sunday is Mother's Day, and if you can give your mom a big hug and maybe help your family by cleaning the house, I am sure that all moms across the country would really appreciate that.
I'd like to start by saying something to all the poor children of Canada. I know that this is such a difficult time for you, cooped up at home and not able to go and play with your friends. But Sunday is Mother's Day. And I would really like to say, if you can, give your mother a hug, give her a kiss. If you can, maybe help clean up the house a little bit. I know it's hard for you, but it is really also a hard time for parents across the country. And I know your parents, and especially your mothers, would really appreciate it. And in the interests of disclosure, I must say I do have a personal interest in sharing this message with the children of Canada. So today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, Dr. Howard New, by video link, our Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough, Par vidéoconférence, le ministre du Patrimoine
via video conference, the Minister of Canadian Heritage, Stephen Guilbeault,
Minister of Innovation, Science and Industry, Navdeep Bains, et le Président du Conseil du Trésor,
and the President of Treasury Board, Jean-Yves Duclos.
Good afternoon and bonjour à toutes et à tous.
Good afternoon to all of you.
Numbers on COVID-19 in Canada. There are now 65,399 confirmed cases, including 4,471 deaths, and 29,000, or 45%, of cases have now recovered. Labs across Canada have tested over 1,032,000 people for COVID-19, with about 6% of these testing positive to date. In the past week, we've tested an average of over 26,000 people daily. We've had quite a few questions about lab testing capacity versus our daily lab testing levels. So I want to take a moment to explain this a little bit further. To be clear, when we talked about a current lab capacity to do 60,000 tests a day in Canada, this is about building up our ability to detect any surge in cases as we relax public health measures. Specifically, a robust testing capacity is a vital component of our case finding, contact tracing, isolation and quarantine approach to rapidly corner the virus. So how do we know we are testing enough? One relatively simple international benchmark for testing is the percentage of tests that come back positive. The lower the percentage of positive tests, the better your surveillance is. When the positive test is really high, it means you're missing a lot of infections. The WHO benchmark is to aim for a positivity rate of 10% or below, striking the balance between casting the net wide, that is high sensitivity, while targeting testing where the virus is most likely to be spreading. Canada has maintained a percentage positive rate below 10% throughout the epidemic. Most encouragingly, our average weekly percent positive rate has been declining from 9.8% in early April to about 4% now in early May. At the same time, we have doubled the number of people being tested weekly since early April, indicating we are casting the net wide. Right now, our testing strategy is evolving as the epidemic slows. In many areas of Canada, testing is broadening to include people with a range of milder symptoms. Provinces and territories are increasing their testing to target people working or living in higher risk settings, such as healthcare, long-term care, correctional facilities, certain work and congregate living settings. When it comes to testing, it's not the number that matters so much, but knowing that you are testing the right people at the right time in the right place. There are multiple other ways that have been proposed to gauge whether countries are testing enough. Regardless of the method, Canada stacks up well against other countries, but we can always do better. This is why we continue to increase our testing capacity. Thank you.
Okay. Thank you very much, Dr. Tam. Et maintenant, je donne la parole au Dr. Howard New.
And now, Dr. Howard New. Dr. New, please.
Bonjour. Comme d'habitude,
thank you. As usual, I will start with the latest numbers on COVID-19 cases in Canada. There are currently 65,399 confirmed cases, including 4,471 deaths and 29,000 now recovered, or 45%. Labs across Canada have tested over 1,032,000 people for COVID-19 to date, with about 6% of these testing positive overall. In the past week, we've tested an average of over 26,000 people per day. We've had quite a few questions about laboratory capacity versus our daily laboratory testing levels. So I want to take a moment to explain this further. To be clear, when we talked about a current lab capacity to do 60,000 tests a day in Canada, this was about building up our ability to detect any surge in cases as we relax public health measures. Specifically, a robust testing capacity is a vital component of our case finding, contact tracing, isolation and quarantine approach to rapidly corner the virus. So, how do we know we are testing enough? One relatively simple international benchmark for testing is the percentage of tests that come back positive. The lower the percentage of positive tests, the better your surveillance is. When the positivity rate is really high, it means you're missing a lot of infections. The WHO benchmark is to aim for a positivity rate of 10% or below, striking the balance between casting the net wide, high sensitivity, while targeting testing where the virus is most likely to be spreading. Canada has maintained percentage positive rates below 10% throughout the epidemic, and most encouragingly, our average weekly percentage positive rate has been steadily declining from 9.8% in early April to about 4% in early May. At the same time, we've doubled the number of people being tested weekly since early April, indicating we are casting the net wide. Right now, our testing strategy is evolving as the epidemic slows. In many areas of Canada, testing is broadening to include people with a range of milder symptoms. Provinces and territories have increased their testing capacity to target people who are working in and living in high-risk areas, such as those working in healthcare, long-term care, correctional facilities, and certain work and congregate living settings. When it comes to testing, it's not the number that matters so much, but knowing that you are testing the right people at the right time in the right place. There are many other ways that have been proposed to gauge whether countries are testing enough. Regardless of the method, Canada stacks up well against other countries, but we can always do better, which is why we continue to increase our testing capacity. Thank you. Thank you, Dr. New.
I will turn it over to Carla Qualtrough. Carla, please.
Thank you, and good afternoon, everyone. Today's numbers of 2 million jobs lost in April show that COVID-19 is having a real impact on communities and families right across the country. Since the beginning of this crisis, we've been focused on providing Canadians with the support they need as we work together to contain the spread of the virus and on ensuring we have the tools in place to keep our people safe.
That's why our government has taken unprecedented measures to support Canadians and their families during this difficult time.
We introduced the Canada Emergency Wage Subsidy to help keep as many Canadians as possible working. To help Canadians who have lost income due to COVID-19, we introduced the Canada Emergency Response Benefit, which provides $2,000 a month to those who need it most. Along the way, we've worked to ensure this benefit is as inclusive as possible to reflect the different realities that Canadians face. To date, over 7 million Canadians have access to the CERB. We know that today's job numbers also demonstrate the real challenges that young people are currently facing in our country. While many have been able to access the CERB, many other young Canadians are anxious about their employment prospects, especially this summer. That's why we announced the Canada Emergency Student Benefit. Students who are not eligible for the CERB will be able to apply to receive $1,250 per month between May and August. Students with permanent disabilities and those with dependents could receive an additional $750 per month. We know that you have additional expenses during this crisis, and we are here to support you. I'm happy to say that we'll have more details about the application process for the CESB soon. In the meantime, eligible students should set up their MyCRA account to set themselves for direct deposit so that when applications begin, they can get their first payment very, very shortly.
These initiatives, as well as the top-up for the Canada Child Benefit and the GST credit, will quickly get more money to Canadians when they need it the most.
Provinces begin to lift restriction and our government continues to take steps toward economic recovery, we'll be there for Canadians. We'll get through these challenging times together. Thank you. Merci.
Okay, thank you, Carla. And maintenant, je donne la parole à Stephen Guilbeault.
And now I will give the floor to Mr. Guilbeault, the Minister of Heritage. Go ahead, Minister.
Hello, everyone. Our culture, heritage, and sports sectors are going through a major crisis. They're under enormous financial pressures because of the isolation measures that deprive them of their audience and their income. The situation is critical. We've moved quickly to stabilize these sectors, which are an important driver of the Canadian economy. On April 17th, the Government of Canada announced a fund of up to $500 million to help the cultural, heritage, and sports sectors. Today, I'm pleased to announce the details, as I know that many are eager to hear more.
The fund will be paid out in 2 stages and will help, amongst other things, meet the needs of organizations which have been touched, will help maintain jobs, and will help keep organizations going whose cash flow and operational viability in the short term are undermined by the pandemic. The fund comes on top of Canada's COVID-19 economic response plan to make sure that no one is left behind.
Canadian Heritage will distribute financial support through its program and will work closely with its partners, specifically the Canada Council for the Arts, the Canada Media Fund, Factor, Musique Action, and Téléfilm Canada.
Our decisions with regard to funding will take into account traditionally marginalized communities, as well as the LGBTQ2, Aboriginal, and minority official language communities.
Full details can be found on the Canadian Heritage website. Our program officers will be in direct contact with the organizations through the usual communications channels starting today. They will do everything they can to address the most pressing concerns. We know that organizations are facing all kinds of serious challenges right now and are doing their best to get through it all. This is why we've put together a streamlined process to distribute these funds.
Our artists, creators, and athletes are key to building healthy, tight, inclusive, and proud Canadian communities. During the lockdown, they helped us feel a little less alone. Their resilience and their acts of solidarity have touched us all. They're still there for us, and we want to be there for them.
Canadians stand behind our creators, artists, and athletes, and we have a message for them. We miss you, we need you, and we will meet again in person.
Okay, merci beaucoup, Stephen.
Thank you very much, Stephen.
Now we are going to hear from the Minister of Innovation, Science and Industry, Navdeep Bains. Please, Nav.
Thank you very much, Christia, and good afternoon, everyone. Since the beginning of this crisis, our goal has been to do everything we can to assist our frontline workers and to ensure the safety and support of Canadians as we navigate this pandemic and these unprecedented economic times. As today's job numbers show, many people are hurting because of COVID-19.
We know that workers in certain sectors were hit very hard. We have to understand their challenges, and we have to continue to support them.
Our approach is to be proactive and strategic and designed to bring the private sector to the table to directly share their perspectives on the scope of the challenges being faced. As our government examines what is needed in this immediate crisis, we need to fully understand all of the challenges. Effective immediately, we're establishing an industry strategy council tasked with helping us identify these challenges. The council will leverage an existing and trusted public-private forum known as Canada's Economic Strategy Tables, where business leaders can share perspectives regarding the challenges they're facing as a result of COVID-19. In response to some particular pressures related to the pandemic, we're adding 2 new tables representing the retail and transportation sectors. They join our existing tables, which have been represented by advanced manufacturing, agro-food, clean technology, digital industries, health and bioscience, tourism and hospitality, and resources of the future.
Over the next 90 days, the Council will meet regularly to identify and understand sectoral pressures that are common across our economy, and members of the Council will help us better understand the challenges.
These pressures range from workforce disruptions to reestablishment of supply chains and consumer confidence, to name a few.
I would like to thank Monique Leroux, who has accepted our invitation to chair the Council. Ms. Leroux has one of the most distinguished careers in Canadian finance, and her impressive background makes her the perfect fit to lead this Council.
And we will be announcing the rest of the Council members in the coming days. Just as we've seen with industry stepping up to assist with personal protective equipment production and medical countermeasures, we are going to work in collaboration with our industry to understand and to make sure that we come out of this stronger and we come out of this together. And with the help of the Industry Strategy Council, we'll do exactly that. Thank you very much. Merci beaucoup.
Okay, thank you, Nav. Maintenant, je donne la parole à
And now, I will give the floor to Jean-Yves Duclos, the President of Treasury Board. Go ahead, Jean-Yves. Thank you very much, Christia, and hello to everyone. The message this morning from the Prime Minister is a message of hope and courage following the recent Statistics Canada survey on unemployment. I'm an economist, and for me, the statistics are shocking, but as a Member of Parliament, this is unbelievable because behind the numbers are thousands of families and workers affected by the crisis. Thankfully, we can count on each other to come through this pandemic thanks to the measures the Canadian government has already announced, including the Canada Emergency Response Benefit, the Emergency Wage Benefit as well, which was mentioned again by the Prime Minister this morning and which will be extended. So it is in a context where we know that after the crisis, if we keep on taking care of each other, not only will we all be stronger, but we will always keep on looking after each other. Thank you, Christia. Thank you, Jean-Yves. We are now ready to take questions.
As usual, we'll start on the phone with 3 questions, 1 question, 1 follow-up, and then we'll turn to the room. Operator.
Thank you. Please press star 1 at this time if you have a question. Puis, s'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question, la première question, est de Marie Vastel du Devoir. À vous la parole.
Oui, bonjour. Ma question est pour Madame.
Yes, hello. My question is for Minister Qualtrough, and it is about the Canada Emergency Response Benefit. Schools and daycares are starting to open. In Quebec, it'll be on Monday, and yet some teachers and daycare workers feel that going back to work would be a threat to their own health and safety. So I would like to know whether a personal assessment should be carried out if a person feels they might be in danger if they go back to work, and if so, would that person still be eligible for the CERB if it is deemed they can stay home? Thank you for the question. It's an important question. Of course, we want to be sure that Canadian workers are safe when they go back to work. And we expect workplaces to do everything they can to ensure the health and safety of their employees by working with public health authorities. There are guides for employers to ensure that workplaces are safe. Now, of course, a worker has the right to refuse to work if he or she does not feel safe in the workplace. But for us, the point is to work with employers to ensure that the workplaces are indeed safe so that all workers can feel confident that their own health and safety are the priority of the employers. So you are saying that a person has the right to refuse to go back to work? In other words, can daycare workers decide not to go to work and still be eligible for the Canada Emergency Response Benefit? Would such an application be accepted? Well, the CERB is available to anyone not able to work for reasons related to COVID-19. If you cannot work because of COVID, you're eligible. It's a personal choice, but I want to reinforce the message that we want Canadians to go back to work. And we want employers to create safe workplaces where the health and safety of their workers is of utmost priority.
Thank you. Merci. The next question, la prochaine question, is from Mike Blanchfield from the Canadian Press. Please go ahead.
Hello, Deputy Prime Minister. This question is for you. The job loss numbers out today are at historic levels in both Canada and the U.S., and yet we're seeing dramatically different responses. There's pressure in the U.S. to reopen the economy and get back to work, but that hasn't seemed to manifest itself in Canada in the same way. How do you explain the difference?
Thanks for the question, Mike, and it's nice to hear your voice. You are absolutely right that the jobs numbers are historic and are and should be profoundly worrying for all Canadians. Our country is going through a very, very trying economic time. In terms of what that means when it comes to our government response and to the response of Canadians across the country, I think Canadians are so smart and they are so sensible. We all knew, we all understood that physical distancing, that shutting the country down was an essential response to the coronavirus. We understood that, we got that, and I'm so proud of Canadians for following that advice. And the good news is, as a result of following that advice, we are making real progress in beating the virus. The same sensible, prudent, smart approach needs to guide the restart. And I think Canadians understand profoundly that the biggest mistake we could make right now would be to squander our hard-won gains. It has been really tough to get here, and the job numbers today show what a big sacrifice we have been making. Our job now, collectively, is to build on that progress and to be sure that as we look towards restarting the economy, we do it very carefully, very prudently, and in a way that will prevent the virus from surging back and enveloping us all. What that does mean, that careful, prudent, smart approach, is that the government has to be there to support Canadians who are doing the right thing. And that is why our government has put in place the largest economic program in Canadian history to support Canadians and to support Canadian companies. We are making really good progress. There is still a way to go in the fight against the virus. And as the Prime Minister said earlier today, the government is here to support Canadians, to support businesses as we finish off that fight. We're going to get there.
Mike, follow up.
Yes, Deputy Prime Minister. Well, given this hard effort that has gone into all of this to get us to this point, what are you saying in your discussions to the United States about the uneven approach that's taking place down there, and what concerns are you expressing about how this might affect Canada, given that it's our largest economic partner, our neighbor, and we share a border with them?
Well, let me just say, Mike, first of all, that we had a very productive conversation yesterday, the Prime Minister and the Premiers. I was fortunate enough to be able to be part of that conversation too, about the restart, about the continued efforts to fight the coronavirus, and also about our border with the United States. In terms of our conversations with the United States, they have been very appropriate to our relationship. They have been really neighborly. They've been really practical and really effective. The border measures that we have put in place, which are unprecedented and have restricted non-essential travel, but have allowed essential travel to continue, have really worked. And our experience of them in Canada is that those border measures have cut down travel across the border very, very much. But at the same time, essential travel continues. We have been in touch with our American partners, and they have exactly the same experience on their side of the border. So that shows that they are really effective. And I think that that is really positive for Canada, for Canadians, for our economy, and it speaks well of our relationship.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you. Merci. The next question, la prochaine question, est de Micheline Laflamme de Radio-Canada. À vous la parole.
Micheline Laflamme, Radio-Canada. Thank you, Mr. Baines. You chaired the Industrial Strategy Council. What do you expect of this council? What will it do in the next 90 days? Are you expecting short-term recommendations? And what economic sectors will be a priority for the Industry Strategy Council? Thank you for your question. I would like to point to the importance to the exceptional leadership of the Council. Monique Leroux has experience in the retail and auto sectors, amongst others. She has a lot of experience, and I am sure that she will work with myself and my colleagues to pinpoint the challenges in each of these sectors. For the moment, we are focusing on addressing the crisis now because the situation is very serious. Over time, however, I hope that we will be able to find solutions to help improve the conditions for workers. Micheline, a follow-up. Ms. Freeland or Mr. Baines, we know that large American auto manufacturers will soon open up their plants again. Have you spoken with your American counterparts, and how are plants going to be reopened in Canada, auto plants? Well, allow me to begin, and Nav can complete my answer, because I know that Nav is working closely with our automotive sector. That's a very good question. And it is key for us to work with our American partners. I know that the Canadian automotive sector is very integrated with the American auto sector. Our industry also has a great deal of international experience within the context of the coronavirus. Many Canadian companies today are working in China in conditions where COVID-19 is present. So I know that our sector has a lot of experience. It will find a way forward, and our sector is working closely with the federal government, with the Americans, and with the provinces. Nav, would you like to add something? Yes, I agree with what my colleague just said. She is right. So it's quite straightforward. We have to work with our American partners. The auto sector is as present in Canada as it is in the U.S., and both sectors are integrated. However, our first priority is the safety of Canadian workers, so we will look at the situation closely every day. However, I am sure that the sector will find solutions which will be to the benefit of workers.
Turn to the room, starting with Rachel Haynes from CTV.
Hi, ministers and doctors. Rachel Haynes from CTV National News. My first question actually goes to Dr. Tam about the outbreak at the Cargill meat facility and the outbreak in High River as well. We've seen a large number of people who have been infected there, but a small number of deaths in that community. Can you tell us a little bit about why you think that is, when there is such a large outbreak, that there would be such a small number of fatalities?
So obviously the province of Alberta is working extremely hard, and my colleague, the Chief Medical Officer of Health there, so they are providing guidance to the industry and trying to, as rapidly as possible, get these outbreaks under control. In terms of deaths, I mean, obviously right now the outbreak is still undergoing evolution, but we know that the fatalities mainly occur in people over a certain age, so it's definitely over 60, but obviously at 70 or 80 years old, you're at a higher risk. So I think part of this might be related to the age groups that might be affected. But we also know that it's not just the workers, it could be their families. So it may depend on what families the workers might be living with, for example. But we do know that the case fatality is driven very much by the long-term care facility outbreaks right now. So I think the work environment is different, but it is definitely a setting where really rapid response when we get cases, in terms of testing and case finding and contact tracing is very important.
Thank you. And my next question is a bit of a two-parter for Mr. Duclos and Minister Freeland. About the wage subsidy, Mr. Duclos, you said a few days ago that businesses would start seeing that wage subsidy. So have all businesses who have been approved gotten that money? And as well, the Prime Minister did say earlier today that as we start to reopen economies, more people will be going back to work and will need the wage subsidy more so than the CERB. But for businesses who have had to shutter completely, for those people, and after June when they don't get the CERB anymore, what is available to them?
Thank you. If I may start with the statistics on the emergency wage subsidies. So as of yesterday, 120,000 businesses had applied, and almost 100,000, I think the precise number is 97,000 of them had their application approved for a total of 1.7 million workers. So these are a large number of workers, and we are very not only proud of the impact of that program, but we're also very mindful that this is going to be important as we move forward. As you said, the value and the objective of that program was to maintain the important relationship, worker-employer relationship as we move through the crisis. And the great news is that a number of businesses, and we expect that to be continually improving, a number of these businesses are going to be able to maintain that important relationship. And as the Prime Minister announced this morning, we believe that it's important to extend that wage subsidies so that businesses have the ability to hire even more workers on the wage subsidies.
Yeah, and I'll just add, I very much agree with Jean-Yves, and I would just add the wage subsidy program is really, really important, particularly now as we are able to begin looking cautiously with great prudence towards economic reopening, because we really all appreciate that the reopening is going to have to be very careful and very gradual. And what the wage subsidy does is it allows a business to operate even not at full capacity. And it allows that business, which is operating not at full capacity, to continue to employ and pay its workers. And I think that the wage subsidy has been a great tool so far. I think we're going to find it to be an even more valuable tool as we carefully move towards reopening our economy.
Businesses who have shuttered and won't be reopening even in the next few months?
Well, there is an ability for not only rehiring, but hiring workers, and new workers included. So it's designed in a manner that gives the businesses the flexibility on the decision and the timing of the decision that they want to use. So it's designed for that particular purpose. We understand that businesses have faced the crisis in many different ways, and that they may want to start hiring new workers at different times, and that's why extending this wage subsidies is important.
Merci, Monsieur le Ministre. On va repasser au téléphone.
Thank you, Mr. Minister. We will move to the lines for 3 more questions.
La prochaine question est de Émilie Bergeron de l'agence QMI. À vous la parole.
Émilie Bergeron.
Oui, bonjour. Ma question est pour Monsieur
Thank
Duclos.
you. My question is for Mr. Duclos.
La subvention salariale,
As far as the wage subsidy is concerned, or perhaps for Ms. Qualtrough, now, this program is being extended, And so what is the potential cost of this measure? According to the Parliamentary Budget Officer, we're up to a cost of $75 billion. So by extending this program, how much could it potentially cost? Of the applications received, how many have been processed so far? Now, with regard to the fiscal impact of this measure, even though we would like to have an exact figure, it's hard to know what the number will be because we are in a period of uncertainty. The Parliamentary Budget Officer has done very good work forecasting, but there's no accuracy in the current uncertain context, and we don't know what the number will be until June 6th, or what the number will be after it is extended beyond June 6th. As for, or rather, Emilie, would you mind repeating the question, please? Your second question. Yes, it was a question on the applications received. How many have been processed so far? 120,000 applications have been received. 97,000 have been approved for a total of 1.7 million workers. Do you have any further questions? Ms. Qualtrough answers. It's an important program, but we still don't know how the emergency response benefit will affect the emergency wage benefit. We're studying the alignment between these two programs. Over time, we will better understand how many workers are choosing to renounce the CERB in order to go back to work thanks to the wage benefit. Thank you very much. Follow-up question? Yes, I have a second question for Ms. Freeland. Many workers, many orderlies and nursing aides in long-term care facilities are asylum seekers whose application has been rejected. There are many Haitians who arrived in 2017. Today, they are working extremely hard, often at a risk of their very lives. Are you looking at regulating their status? Thank you for the question. I would like to begin by thanking everyone who is working to help our seniors in extremely difficult conditions and dangerous conditions. They are doing an essential job, and I would also like to highlight the work of the men and women of our armed forces who are lending a hand in this situation. So thank you to all of you. You're working very hard for your country. Now, with regard to the asylum seekers, as you know, Canada has a fair system in place. Canada's system is well regulated to determine who has the right to asylum in Canada. So it is very important for us to be a rules-based country, and we will continue to be a rules-based country.
Operator, next question, please.
Thank you. Merci. The next question, la prochaine question, is from Althea Raj from HuffPost Canada. Please go ahead.
Hi, thanks. My question is for Dr. Tim. I'd like to go back on the comments you made at the outset of the meeting. You repeated basically that the 60,000 is the public health laboratory capacity. Now, that's been explained to us that is the amount of tests that can be done daily. If we are only doing an average of 26,000 tests, what is the problem? Do we not have enough tests? Do we not have enough people to administer the tests? What's preventing us from going to 26 to 60? Thank you.
There's a number of factors. That is the capacity of the public health laboratories. And what you want to do as you progress in this epidemic curve is to flexibly escalate testing as needed. So if you were in a certain province where the outbreak is actually under control, right now, those provinces are increasing their testing, not because they've got cases necessarily identified right now, but they are widening the net to test more people with, say, milder symptoms. So they may increase in testing just by widening the net, just to see if there's any ongoing community transmission, for example. Other provinces are in a very different situation. For example, of course, in Quebec and Montreal, where they are escalating testing right now to do broadening testing in that area where they're actually still having some outbreaks, knowing that outbreaks are occurring in their long-term care facilities, but also trying to see if there's any transmission that is happening in the community. So you're seeing them escalate the testing to fit with the epidemiologic needs, which is why I think part of it is that, there is no magic target to just keep testing at a certain number. It depends on where that epidemiology is at. But only to say that all provinces are looking at ways at which they make sure, when we're in the middle of that epidemic curve, a lot of people were told to stay at home. And if you got milder symptoms, you may call your health line and talk about when you get tested. But many of them would have actually sort of stayed at home, and their symptoms would have essentially resolved, and they would then be able to continue. But in this newer stage, these people will now be able to get tested, for example. That's how I think the numbers might go up, but it will go up and down. The percent positive tells us a little bit about how sensitive that system is. And for many of the provinces, they're at a very low percentage rate right now, which means while they're doing more testing, they're not detecting those positives. So it's not a straightforward, we must reach a certain number of tests per day. I think that will still fluctuate. The important thing is we've got that buffer, we got that surge, so that if there is a case or a cluster, the local area will be able to jump on that and rapidly increase their testing as needed as well. So that's the sort of idea going into that next phase.
Altia, follow-up?
Thanks. Yeah. So I appreciate all that you've said, and I think that you've kind of made these points repeatedly throughout the week, and we understand that the provinces are basically using their resources as best as they can to address their own unique challenges. But my question is, why are we not testing more? What is preventing us from going from 26 to whatever the magic number may be? It doesn't really matter what the magic number is, but you and the health minister have both said that we need to have more testing capacity. We need to increase that. We need to have more tests done. More people need to be tested. So why are we not testing more people? You said there were a number of factors. Can you elaborate? What are those factors? Do we have enough tests? Do we have enough people to administer the tests? Why are we not testing more?
So I think it depends on where you're at in the country as well. So obviously, there is an actual public health laboratory capacity to do those tests. Some of it now depends on need and whether people actually need to test that many in order to ensure that they don't have community transmission. I think that's the most important. Two is that, as you've heard, every day we're managing laboratory supplies. Right now, we're addressing provinces' needs, but that is a very dynamic situation. So one day it could be managing swabs, the next day it could be reagents. But all we can say is that right now, with all the different streams of increasing laboratory capacity, that capacity is continuing to increase as we speak. But even in the last week, I think it was within the last week, you've heard about some of the newer point-of-care tests that we're hoping to put in place as well. But some of those are new innovations. And so the Spartan test, for example, required further testing. So every day there's a dynamic in that laboratory testing approach or strategy. So it could be a number of different factors. Right now, I'm not hearing anything specific about swabs or about reagents. But I'm not saying that next week or the week after something suddenly wouldn't happen. But right now, based on all the provincial territorial, particularly provincial laboratory capacity, this is the capacity that they have in place.
It's Dr. New. Maybe I can just build on what Dr. Tam has said. As we both said repeatedly during this week, it's all about testing sort of the right people at the right time in the right place. So I just want to maybe unpack that a bit. So first of all, it doesn't make sense to just test people randomly. If people don't actually have the infection, what you're actually doing then is that by testing these people, you have a higher chance of getting what we call false positives. There's no test in the world that's 100% foolproof. And so you can imagine if you test a whole bunch of people who actually don't have the infection, then all you'll end up most likely is with a bunch of, quote, false positive results. So that's why it's important to test the right people who actually you think, obviously from a public health and clinical point of view, actually have the infection. So that gets to the second point in terms of at the right time. As we all know, the molecular test that we're using right now is all based on detecting the virus. And it may well be, as we all know, if you test someone who might actually really be infected with the virus, but they're still within the early part of what we call their incubation period, that means the viral load might not actually be high enough. So if you were to give a test at the wrong time or too early, you'll actually get a negative result. And then 3, 4, 5, 6 days later, they may actually then develop the symptoms and have high enough a viral load to actually get a true positive result. So you might actually give a false assurance to someone with a negative test if you've tested them too early. The other point, though, is sort of like you say, in the right place. And so, as Dr. Tams pointed out, we're certainly, with the provinces and territories, focusing on those high-risk situations. If there's an outbreak in, for example, a long-term care facility or in a prison setting, of course you need to focus in testing and have a, quote, a higher level of diagnostic suspicion and testing both the residents and the staff in those types of settings. And then the last point, which I think maybe people may not quite understand, is that if you do a test at a certain point in time and you get a negative result, that doesn't clear you. It just means that up to that point, you haven't been exposed, you have not been infected, and test is negative. But if you go out afterwards and sort of, forget about all of the proper measures that should be taking place, like physical distancing, etc., and expose yourself, you may well still get exposed and get infected with the virus. So a negative test result also doesn't clear you sort of from that point on. So I think those are the kinds of details that maybe need to be, I think, further underlined by both Dr. Tam and myself going forward. Thank you.
Okay, but my question
Thank you,
was
Dr.
really
Althea. It's one question, one follow-up. Sorry.
No, I
you have colleagues waiting. Sorry. Operator, next question, please.
Thank you, merci. The next question, la prochaine question, est de Catherine Lévesque de la presse canadienne. À vous la parole.
Catherine Lévesque from the Canadian Press. Good afternoon. I just want a clarification from Minister Qualtrough. Daycare workers and teachers, many of them will be going back to work in the next few days. Do they have the right to refuse to go to work and yet still be eligible for the emergency response benefit? Thank you for the question. Well, my message is this. It is important for workplaces to be safe and that the health of employees be protected, and that this be the first priority of employers. Throughout Canada, workers have the right to refuse to enter an unsafe workplace. This is not what we want. We want workers, we want public health and employers and workplaces. We want all of these partners to work together to ensure that workplaces are safe so that workers can go back to work. Again, a workplace has to be healthy and safe. Catherine, follow-up? Thank you. My other question is for Minister Guilbeault. I don't know if it's fatigue or because it's Friday, but I don't quite understand what that fund will be used for. Can you give us more details on how the fund you mentioned will be disbursed based on information documents I've received? The organizations you mentioned will not be eligible for the CERB or the wage benefit if they take money from the fund? Thank you for the question. I would like to come back to the last part of your question. Just because an organization would receive money from the fund we have unveiled today or announced today, it does not mean that they will not be eligible for the other measures we've put in place, including the SERVE. What we're saying today is that the arts, culture, and sport sector are so specific, so distinct that they need special attention, and that some of the measures we have put in place don't really work or work as well in these sectors as elsewhere. If you're a nonprofit, it might be hard for you to get credit from a banking institution because your room to act is already fairly limited. Many autonomous workers, self-employed workers are eligible for the emergency response, or rather are not eligible for the emergency response benefit. And so we are introducing new measures to plug the holes which we have discovered in the last few weeks. We're trying to help as many Canadians and organizations as possible, and we've realized that some of the measures we've introduced don't necessarily work for everyone. So we have set aside $72 million for the sports sector. Thanks. We have Olympic Games and Paralympic Games, and athletes can qualify for government support to participate in those games. Now, the Olympics have been moved back by 1 year. Many athletes have qualified for the Olympics, and this money will help them keep on training for the Olympics, which will be held next year. As well, new athletes would have arrived into the system after the Olympics, which would have been held this year, and they would also receive support from this $72 million fund. So money in this fund will go to organizations already being supported by Heritage Canada, including Telefilm, the Canada Council for the Arts, and others. We're also going to set aside money for organizations which do not receive support from Heritage Canada or other organizations. So we know full well that the programs we have now are helping many organizations, artists, and athletes, but not everyone. So given the scope of this crisis, we decided to create a new program to help those organizations. Thank you, Mr. Minister. A final question from the room.
Photo Department. My question is for Freeland. Is the U.S.'s haste to reopen good or bad for Canada?
We are very clear in Canada that Canadian leaders and Canadian people make decisions about what's right for Canada. And I think none of us would appreciate it if other countries were to offer verdicts or judgments on our decisions. And I think that's the right attitude to take.
My follow-up is actually a separate question, and it is for Tam. Elderly people that are at home that have been being very safe and not going out and getting maybe a friend or a neighbor to do their groceries, is it safe for them to go do their groceries right now?
So I think that depends on where you are. And it would be up to really listen to your local medical officer of health, because I do think that, as I've said,
Ford the other day said that medical officers, weren't doing what they need to be doing. So without this information in each area, how can people make the decision to know whether to go out and be safe?
So I think, as everyone knows, that people of older age are at much higher risk of severe outcomes. And where you are really matters right now, because the disease activity is different and the local medical officer of health is in the best position to do that. Of course, having said that, in many communities, there are different approaches that people have taken. Like even in grocery stores, people have a certain hour where perhaps seniors can go and shop as opposed to, other age groups. So there's many ways in which I think different communities are looking at how they support the seniors, because it is very important that they be able to, have those connections and be able to do what they need to do to sustain daily activities. But it is actually very different if you were living in, different cities or different towns. So you do have to ask that question of your local public health.
Thank you, Dr. Ceci met fin à la conférence de presse pour aujourd'hui.
Thank you. This concludes today's press conference.
Thank you. Merci. The conference has now ended. Please disconnect your lines at this time.